It is now 2 p.m. Eastern Time. You have joined the Justice and Mental Health Collaboration Program Field-Wide Webinar on integrating criminal justice and behavioral health data. To allow for additional sign-ins past the hour, we will be starting this webinar in a few minutes. Good afternoon. Thank you for joining today's Justice and Mental Health Collaboration Program Field-Wide Webinar on integrating criminal justice and behavioral health data. My name is Ethan Kelly, and I am a Senior Policy Analyst at the Council of State Governments Justice Center. I will be moderating today's webinar, which is hosted by the U.S. Department of Justice, Bureau of Justice Assistance, BJA, and the Council of State Governments Justice Center. To give you an overview of today's webinar, first, we will do introductions of our panelists and organizations. You will learn about a resource to help assess your current information technology infrastructure and guide the development of a cross-system data warehouse. We will hear from a Jmhcp grantee site to talk about their efforts to build an integrated data system. And towards the end of the webinar, we'll have time for questions and answers. Just a few housekeeping items. Anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen to enter your question. This includes both technical and content-related questions. We will try to reply to technical questions in the chat as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please click on the link that we shared within the chat. Please understand that there are some technical issues we may not be able to resolve. We are recording the webinar and we will post it along with the PowerPoint slides on our website within 1 to 2 weeks. Now for our introductions. Our panelists today, we have Risa Hannenberg, who's the Deputy Division Director with the Behavioral Health with the CSG Justice Center. We have Nicholas Haganey, a court policy analyst of the Office of Court Administrator, Superior Court of Fulton County, Georgia. and Bob May, Program Director of the IJIS Institute. Thank you all for joining the webinar. So now I'm going to give you a little background of the Council State Government's Justice Center. The Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government. With the expertise of a policy and research team, our staff develops research-driven strategies to increase public safety and strengthen communities. This slide describes a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide. The overarching goals that guide our work at the CSG Justice Center are to break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. We do this work with the funding through the Bureau of Justice Assistance and the Office of Justice Programs, which we would like to tell you about. BJA's mission is to provide leadership and services in grant administration and criminal justice policy development to support state, local, and tribal justice strategies to achieve safer communities. BJA works with communities, governments, and nonprofit organizations to reduce crime, recidivism, and unnecessary confinement and promote a safe and fair criminal justice system. The Justice and Mental Health Collaboration Program, or Jmhcp as we call it, was established in 2005 and is funding the training today for the field at large. Through the Jmhcp, BJA aims to help states, local governments, and tribal organizations improve responses to and outcomes for people with mental illnesses or co-occurring mental illness and substance use conditions who come into contact with the criminal justice system, and support public safety by facilitating collaboration among the criminal justice, juvenile justice, and mental health and substance use treatment systems. And with that, I will turn it over to Risa to talk briefly about the data integration checklist. Risa?
Thanks, Ethan. Good afternoon, everyone. It's great to be with you all this afternoon. And I see that we have quite a few people, over 300, that are registered for this webinar. So we're really thrilled for that. What we're going to be sharing with you today is based on this publication that we released actually last year on integrating criminal justice and behavioral health data. This really stems from our work at the Justice Center with many of the grantees and sites across the country that are particularly working with, if you wanted to call them familiar faces, high utilizers, but that population that is coming not only into your criminal justice system, but we know that they're also coming into other large systems, be it your local hospital emergency room, your homeless shelter types of services, EMS, other kinds of services that you would then want to start tracking the number and the amount of frequency that the same person is touching each of these various service entities as a way of identifying them and pulling together and providing better and more coordinated services for this individual as a way of hopefully working with them and preventing the ongoing cycle of re-entering the justice system. So we put together as what we will hope, and Bob's going to go over kind of a step-by-step, if you will, to what it takes to pull together and have an integrated data system. And then also a companion tool that we have that works with this particular document is also one on selecting an external vendor, knowing that many sites across the country don't have internal capacity to actually build an integrated data system, and that they will look towards an outside vendor to assist with that project. So I just wanted to provide that background, and I'm now going to turn it over to Bob, who's going to walk you through these steps. So thank you.
Thank you, Risa. Good afternoon, everyone. The IJIS Institute's a nonprofit alliance. We work to promote and enable technology in the public sector and expand the use of sharing to maximize safety, efficiency, and productivity. Again, we're a nonprofit, and our members are people from the solution provider industry, also called vendors, and we advocate for policies, processes, and information knowledge on behalf of stakeholders to enable information technology systems to better serve the practitioners to accomplish their goals. Next slide, please. Again, we have members and associates, which are practitioners like most of you, across major public sectors. Back in 2001, when we began, we were largely focused on law enforcement, but since then we have evolved, and we're now covering the areas you see here: law enforcement, corrections, courts, fire, emergency medical, emergency communications, Homeland Security, Health and Human Services, prescription drug monitoring, school safety, and transportation. Because when you're talking about information sharing and breaking down silos and barriers, you're obviously getting out of one domain and into another. So the reality is it covers all domains. Next slide, please. This is an example of some of our national projects that we've completed to date. The ones in blue are the ones most relevant to the subject of today's webinar: justice and health information sharing, corrections, reentry information sharing, health and human services interoperability, prescription drug monitoring program, which we've been running since 2005, and improving school safety through information sharing. So you can see the common link there: solving problems in a variety of sectors and domains, all about information sharing and solutions. Next slide, please. So we're first going to talk about the building and maintaining of a data warehouse. And later you can see we'll talk about selecting IT vendors, and then we'll turn it over to Nick for Superior Court of Fulton County, and then Q&A. Next slide, please. Data integration. Obviously, that's what the subject of today's webinar is. It covers areas such as information technology capacity. As Risa said earlier, the checklist is built to basically do a self-assessment of where your organization or jurisdiction is, what capabilities they have, and help you determine, in addition to the self-assessment, determine if you're going to have to go outside for a solution provider to build your data warehouse. For the purpose of today, a data warehouse is a central repository used to house information from multiple sources, and it can consolidate individual and system level data and allow data tracking to identify relationships and trends. And of course, you can have all kinds of generated automatic standard reports, dashboards for different users, obviously, because different users have different needs. The agency head may want to see the big picture data, and the program manager at the homeless shelter may want to see very specific data related to the homeless issue. So dashboards can be customized to meet the needs of a variety of users. Next slide, please. Again, the purpose of the checklist is to lay out those steps. A variety of people from your jurisdiction will be required to complete it because it will include input from operations, IT people, administrators, and managers. The completed checklist will help inform your data integration planning and describe where you are in the next steps that are needed. It may also help you identify some steps or things that you hadn't thought about, especially those who have not done this before. And the results can be used to help guide your planning process, which will move forward as a result of completion of the checklist. Next slide, please. The checklist is divided into 3 phases: planning for a data integration warehouse, developing a data integration warehouse, and implementing and maintaining a data integration warehouse. And we'll go over each of those briefly in the following slide, please. In the first phase, planning for the warehouse, kinds of questions the checklist will ask. And if you look at the document itself, you'll see you have various categories that will characterize where you're at with that. This task has been completed, this task is underway, this task is being planned, or nothing has occurred as yet. So you basically check those columns that fit each of the questions posed in each section, and that helps you see where you are. So do you have an established governance group, or are you past that point? Has the governance group identified and shared goals yet? If not, you would mark accordingly. Has it analyzed existing data collection efforts from behavioral health and criminal justice to know where the data is, or what data is needed, or what data is not even being collected yet that perhaps needs to begin to be collected? Does your jurisdiction have necessary IT expertise and infrastructure in place? Does your IT have the bandwidth to take on such a project? Are the appropriate data sharing agreements in place to enable this to move forward? And how about the required financial resources available to move forward, either with your own IT or through a vendor? Next slide, please. Developing the warehouse, again, you can see the planning process as you move through the checklist. Has the governance group created a work plan to guide the development of the warehouse? So do they know where they're going? If not, that's obviously a step that has to be done. Have the appropriate staff, and you'll see later in an organizational chart, have appropriate staff identified and address security and privacy issues that have to be addressed before you can do this. And has necessary user testing been conducted or planned to ensure that the data warehouse is functioning properly? We'll go into that a little bit later, but that is a critical step in the process. Next slide, please. Phase 3, and by the way, the checklist is much more detailed than this. This is just the high points of each phase. There's a couple pages on each phase in the actual checklist. And this is phase 3, the implementing and maintaining a data integration warehouse. These are some key questions that we'll talk about in a little bit related to contracts with vendors and so forth. But are training and ongoing supports in place to assist users? Your users are going to turn over all the time. New staff will come on board. So you can't assume that once you get started, everybody's on the same page. So you have to have a process in place to train new staff that are gaining access to the data warehouse. This is really critical, especially regarding security practices, because they need to know the policies and rules they have to comply with to be able to have access and use it properly. What quality assurance and improvement mechanisms are in place? This is critical, and Nick will probably talk about this, to make sure that information being put into the data warehouse has gone through some kind of quality assurance is accurate data, because the last thing you want is to be getting data reports out of the warehouse that are just not reflective of the real picture. So you want to make sure you're not putting bad data into the warehouse. How is the governance group working to financially sustain the data warehouse? This is, in my opinion, a task that has to go on all the time. Even if you land a grant or get county funding to build the warehouse, you have to sustain it. There's going to be a cost to going forward. And you can't just wait till budget season to go tell everybody how great it is and how much you need it. You have to be building the case for people to see its value all the time. Don't keep it to yourself. You got to come up with a strategy to make the policymakers and the funders in the county, as well as the public, aware of the benefits you're receiving from this and how important it is to continue. It makes it a lot easier at budget season if you're doing that all along. And our policy in place to prescribe how data warehouse will be enhanced or modified to meet future needs, because that's going to be an ongoing thing. It's not a once and done situation. The more benefit you get out of it, the more potential you'll see, and the more things you're going to want it to be able to do. and perhaps expand the data reach to other agencies and so forth. And are stakeholders regularly informed about the value? I've spoken to that just now. That's real critical. Next slide, please. I mentioned the graphic. This is the top half of the graphic. It's too big to put onto one slide. So this is sample organization stakeholder structure that one might use for development of a data warehouse. It's not necessarily, doesn't have to be this way, but we wanted to give you an idea of what a typical one might look like. And of course, the county board would be the final decision makers. They are over everything that happens within the county, in particular this situation. Under them may be a criminal justice behavioral health partnership that you may already have in place in your county. And obviously they're having the overall goal of the cross-system integration, their goals to do the things that Risa talked about earlier in the webinar. They've got to be able to find this data and pull this data together to see who these familiar faces are and what their experience is in both systems, to find the best ways to interact with them to break them loose from that pattern. Then under the behavioral health partnership group is likely to be a governance group that's more specifically focused on what we're talking about today, and would include representatives from all the stakeholder agencies, of course. And you're going to have to constantly maintain their buy-in. And then under that group, they should have an assigned project manager or someone of similar title to coordinate all the work, the day-to-day overseeing, getting it done, reporting back to the governance group on the status of things, getting the governance group support decisions that have to be made and so forth. And we'll go into that in a little more detail. Next slide. This is the bottom half of that upper slide we just showed you. And this is a sample of the structure of what might be broken out underneath of the program manager and the governance group. An IT subcommittee, obviously they would, even if you hire a vendor, they're likely to have a role in everything that the vendor does, because they're your technology experts in-house that can help you understand the things that the vendor is doing or trying to do, and be able to make good decisions about that. A data warehouse vendor, if you go that route, that would obviously become a spin-off of the IT subcommittee. And in the privacy subcommittee, I mentioned earlier, there's the importance of privacy and security and making sure all state and federal regulations are being obeyed and followed, and even any county statutes that you may have to deal with. So that would fall under that subcommittee, and these people would be people who would likely have the expertise on those issues, so they can make good ideas and good decisions about what is needed and how to do it. Performance metrics subcommittee, obviously you need to be able to set goals and determine if you're reaching those goals. And if you're in a BJA grant, you're very familiar with that process, because all the grants have the performance metrics requirements to be able to show how you're doing and measuring up. So this committee would develop those to make sure, and goals would change all the time. After you meet certain goals, you may have higher bars to meet, and this group would do that. And then finally, the sustainability subcommittee. These are the people who would help grease the skids for funding, current and future funding, and help get the message out about the data warehouse, and sort of identify other human resources as well as financial resources to meet its both current and long-term needs. Next slide, please. Next, we're going to talk about selecting the IT vendor, and this is the program brief Risa mentioned. We're assuming now we've completed the checklist, and we're now decided we're going to hire an IT vendor to build us a warehouse. And this is the program brief and some things to consider when doing that. Next slide, please. This is a snapshot of the program brief that I mentioned. And again, as Risa described in the beginning, it's going to help you make the right decisions and do the right things and consider the right issues as you move forward with selecting an IT vendor, because it's easy to make some mistakes or not do some things here that may come back to haunt you later. So it's intended to help you prevent you from having that occur. Next slide, please. The purpose of the brief is to provide key considerations when planning to hire a vendor. You want to understand your governance group's readiness, select the most appropriate vendor to meet your needs, and manage that relationship. And it's really important. Obviously, it's sort of like when you go to buy a car, and this is not taking a swipe at vendors, but every vendor wants you to hire them to do and they think that they're the best, but you have to determine if they're the best for you. So you've got to look beyond the sales pitch and get into the nuts and bolts of the things that will be important to you that they can come with and bring to the table. And it's not just all about the cost. Obviously, there's a cost factor, but the other things are just as equally serious to consider. Next slide, please. After completing the phase 1 of the checklist, you've assessed your readiness of your IT capabilities to help you decide, as I said, if you need the vendor. And then questions answered by the vendor selection brief. What are the key considerations that you're looking for? What kinds of skills and abilities are you wanting in your vendor so you can have confidence that they're doing what you want? You're likely doing this for the first time, so you're likely to want a vendor who has done this before and can bring some help along the way beyond the technical solution to help you do some things maybe that you haven't thought of, and to offer them up as possibilities. What you need to include in the scope of work for a vendor is really important, because change orders and add-ons later can be problems for your budget, can be problems for time, because when you do a change order, time is involved. And if you've done those in the technical world before, you know how much time they may take. And what critical activities are needed to manage the vendor through the development and operation of the solution. What role will they play once the warehouse is up and running? Do they have a continuing role? Does that end their involvement? Are your IT staff able to take it from here? Those things you'll have to sort out. Next slide, please. And again, understanding your governance group's readiness to approach the vendor. You want to have your ducks in a row, so to speak, with your governance group before you get to this step. Because first of all, the more accurate picture you paint for the vendor or potential vendors, the more on point their proposed solution will be, and the more cost efficient it will be. If you're vague about what you need, they're going to have to build extra cost and time into their solution to make sure they cover everything you might want. If you know what your end goals are, have a good read on those and can share them with them, they'll be able to bid on exactly what you've asked for. And that's good for them and it's good for you. Part of that is designing the system requirements of the functionality. And this takes a lot of time and effort on your part, and whoever vendor you hire will probably work with you to help refine that even further, and may come up with some requirements you hadn't thought of. But this is about what type of data do you want into the warehouse? What do you want that data to tell you? And how do you want it to be accessed? And how do you want users to have access and role-based access? Because every user doesn't have the same access to all the data because of HIPAA and other reasons that you may have. You'll have to set up roles, and different staff will have different access to the data warehouse data. what types of reports and dashboards. We talked about a variety of dashboards, not just one dashboard for various agencies to get out of it what they want. They're going to want something probably a little different than the other agency may want. And if possible, and you can afford it, you want to make sure that that capability is there. User access methods I mentioned, and system security and user management. It's so important. One bad thing happens with misuse of data or something, and the whole thing could come crashing down. So it's not to be glossed over. Next slide, please. Okay, now we're at the point where we want to select a vendor. You want to do your research before you do that. And the best information in my experience, and I think Risa may agree, is to talk with peers in other jurisdictions that may have already done this or may have already used vendors who have have these capabilities and can give you not only references about them, but things that they would have done differently, lessons learned. Nobody gets it right the first time. So everybody, no matter how good a planning job you do, you're going to later after the fact discover, boy, I wish we'd have added this or wish we'd have done that. Those types of pieces of information are just so valuable that you can get that from a peer and make sure you get that part into yours so you don't have that same occurrence. You want to craft a comprehensive solicitation, as I discussed earlier. You want it to include everything you want to do, all the functionality. So the working group has already worked through all that to figure out what they do. It's never going to be the final. There's always going to be tweaks later, but you want to think through that process and the end user's role in doing accessing the data so you can describe that. You don't want to tell the vendor how to build it. You want to tell them what you want it to do and let them determine the technology solution that they think will best meet that. Often people try to be so prescriptive that they actually tie the vendor's hands, and they may not be able to bid on the best solution for you because you've overprescribed things that you think that should be part of it. So you want to be very careful about that. And carefully review the solicitation after it goes through procurement. Sometimes they may, on purpose or accidentally, remove some requirements or terms that you had in there that are critical. And if that's the case, you want to catch that and discuss it with them before it's actually released. Next slide, please. Again, avoid selecting a vendor by word of mouth. Not that the references from peers aren't important, but you want those word of mouth endorsements to come from people that you really trust or you know has done something similar. Because a vendor may be great at this, and maybe this isn't exactly that, and it might not work out so well. So you just want to make sure. Consider a scenario-based interview for best and final vendors. If you're doing final interviews, give some use cases of the way you're going to do things and let them respond to that. If obviously check references, but if they've done similar data warehouses in the past, ask for a demo of that. And maybe even before the interviews, you can go to the jurisdiction where they've done it and ask to let the jurisdiction show it to you. Before you even decide whether you want them to be part of the best and final reviews. And was the work completed on time or under budget? That's really important. Some vendors are really good and they're so busy that maybe they can't do your work in the time that you want, but they might not come out and say that because they would like to get your business. So you really need to press on that issue to make sure they have bandwidth to do your job according to your timeline. And again, we mentioned about being experienced in data warehouses, and do they have the right qualified people available for the project? You want to talk to references about that. Did the people they promoted at the interview phase actually turn out to be the people that did the work? or did they pass it down to less qualified staff, and was that a problem? So I'm not suggesting that that happens, but you want to ask about that so you can make sure if it has happened that you don't let that happen to you. Next slide, please. Managing the relationship. This is really important because this is hard work, and it's going to have to be a partnership with your vendor. You can't just hand over the keys and hope it turns out right. You're a part of that, and they're a part of your planning group to develop this. And it will help you avoid any confusion or additional cost or delays. Again, don't try to negotiate with the vendor by the whole governance group. That could turn into a real nightmare. You can have a smaller group handle that and report back to the governance group, so they're still part of the decision making, but it could not end well. It might confuse things. Include a clear scope of work and timeline. We talked about that. Make sure you know what you're asking for, but don't be too prescriptive. Talk about development of interfaces. How are each agency coming from a different case management system, a different web interface? How do they get into the warehouse, and what do they see? And make sure that that's included in the work. So, when you turn the data warehouse on, the health department can't get into it because their web interface doesn't work. So you want that included. Maintenance and support. You want at least 3 years of maintenance requested. You want to also find out how long the vendor will support the solution. Just like with Windows 7 and Windows 10, there's a point in time in the future, maybe 5-7 years, where they will no longer support that. And if that happens, you really don't want to continue to use it, because that means you could have security patches that are no longer fixed because they're no longer supporting it. You don't want to risk the data integrity and security by allowing that to happen. So you need to find out about that. You don't want to get a good price on a system that's only going to be supported for 2 more years, and then you have to pay for a major upgrade. Training for initial staff and tutorials and other training tools to train other staff that come on board after the initial contract or changes to the warehouse. And include training on extract reports. You want to be able, if possible, to do as many these ad hoc report queries with your own staff as possible. It's best not to have to depend on your vendor to be able to generate those. So hopefully they build a system where your people will be able to do the ad hoc queries, because first of all, that'll be faster. If the sheriff wants this today, your IT guy can do the ad hoc query and pump it in and get the answer today, and it'll be less costly than if you go outside to the vendor for those kinds of things. Next slide, please. Again, managing a relationship, a few more things. I really recommend an incentive-based contract, not a penalty-based contract. A lot of procurement people like to fill them full of penalties so the vendor doesn't do this and doesn't do that. And sometimes the vendors are forced to just not be penalized instead of spend their time on what you need them to do. So I'm a proponent of incentive-based contracts where you actually give them incentives for getting it done, maybe getting it done early, coming up with cost-saving ideas. You'll still have to have penalties and timelines and all of that, but don't focus on that. Try to focus on better outcomes. Project managers should maintain regular contact with the vendor. They don't want to be best friends, but they need to have a relationship where they can deal with issues as they come up, and on a positive partnership basis rather than an adversarial basis. Make sure you do have a beta testing phase for everything, so you can work out the bugs. What you don't want to do is rush to production, and in the first 5 days it's operating, you get 35 change requests because it didn't do this, didn't do that, didn't think about this, didn't think about that. So you want to minimize that by having a beta period where where actual users are testing it in your agencies. And so number one, they feel more positive about it because they're part of the rollout and the testing, and that will minimize the issues later on, as well as keep your costs down because of fewer change orders and delays. You want to test your role-based access. So if you have one employee who's only allowed to see A, B, and C data, and another employee is allowed to see all data, you want to make sure that that's the way that works, so they don't accidentally have access to data they're not authorized to see. And obviously, policies and procedures for use of the warehouse is the ultimate goal, to have these procedures all laid out, and you'll be developing them along the way. That's not going to be something your vendor does that you're going to have to do. Next slide, please. And with that, I'm going to turn it over to Nick to talk about Superior Court of Fulton County. Nick?
Yes, thank you, Bob. Hi, everyone. My name is Nick Haganey. I work for Superior Court of Fulton County in Georgia. For anyone unfamiliar, Fulton County is Atlanta. Fulton County encompasses most of the city of Atlanta. So we're a very large, very densely populated jurisdiction. Can you go to the next slide? So first, I wanted to start off with just giving some background on what has really kind of led us to engage with this data integration, data sharing work. I am hired as part of a Familiar Faces project, which is one of the many projects kind of under the umbrella of the Fulton County Justice and Mental Health Task Force, which this task force was formed in 2016, long before I came on board, when Fulton County adopted the National Stepping Up Initiative. So they convened this task force. It consisted of agency heads and organizations and stakeholders across the county and city, really covering most all of the intercepts for like our criminal justice and behavioral health systems. The task force engaged in like a planning period in which they did a sequential intercept mapping exercise. They developed business cases and prioritized recommendations related to those business cases. And the number one data related recommendation was build a data sharing tool. What this tool was not very well defined at all. Nobody was put in charge of it or given like a direction to lead this work. But it was just generally recognized that this was something that was really needed to push this kind of criminal justice, behavioral health work forward. But since nobody was in charge of it, it kind of sat dormant for more than 5 years. I came on board with the county at the end of 2019 as part of this Familiar Faces project. And so, you know, like probably most everyone knows, Familiar Faces are a small group of individuals with very complex needs. They've got co-occurring mental and physical health issues, substance use disorders, and many of them are often chronically homeless. We know in a jurisdiction like Fulton County, which is so big, like we have huge volume challenges, and without some kind of data sharing structure in place, there's going to be a lot of people who fall through the cracks and don't get the attention or services that they really need. And we've seen the consequences of that through this project and through the task force's work as a whole. People don't get the services they need, they decompensate, they end up in crisis, and they end up back at the jail, or they end up at Grady, our local safety net hospital, in some kind of mental health crisis. The outcomes are generally bad, and there's a very high cost to both the individual and to the county financially. So next slide, please. So this work has really just kind of re-highlighted the need for some kind of data sharing system in Fulton and Atlanta. We know and we see firsthand that there is a lot of informal information sharing going on. Like the public defender's office will engage with community service providers and behavioral health organizations in order to get their clients the services that they need. But this is this is an informal process. No information is collected. There's no paper trail. There's no way to analyze like volume or effectiveness. And it all just kind of gets lost in the ether. So based on all of this information that we've learned through our familiar faces work and through the task force as a whole, we really recognize that this was a project that we needed to get off the ground, like up and running. Next slide. So initially we started out small. In late 2019, we instituted the correctional mental health screen at booking at our county jail facility. The results of which are collected by the Fulton County Department of Behavioral Health. And so the first thing we did was we linked our jail booking data feed with the results or with the database that our Department of Behavioral Health uses to collect the screening results. Now, this was a pretty easy data connection to make because we're a Fulton County institution. The Department of Behavioral Health is also a Fulton County institution. So all it really took was agreement from agency heads and then our strategy and IT offices to actually, make that connection and make that data available to us. We've used that data to create a stepping up dashboard as well as a familiar faces dashboard. Here you can just see kind of some an aggregated snapshot of some of the information that we collect and visualize, but these are private dashboards. So unfortunately, I can't share like the full dashboard with everyone. But this data also allows us to do like retrospective analyses, look at time trends, and as well as just like drill down on individuals who may need special attention as part of our like reentry planning. So it's been really useful, but it's not comprehensive. It doesn't touch a lot of the behavioral health systems that we need to really get a holistic picture of individuals' needs, of like the volume of those needs, or kind of getting at program space or like vacancies as far as like filling up programs with the people who need to be in them. Next slide. And so this is just kind of the same thing. This is key measure 2 from our stepping up dashboard. And so another thing I wanted to touch on is that because I'm a court employee and because this familiar faces work was born out of Superior Court, is that our primary source of information is only criminal justice data. So our familiar faces cohort is solely populated based on like arrest and booking information. But in reality, we know that there are going to be people who may have slightly less arrests or bookings, but they have a lot of connections to behavioral health, homeless services, that are maybe not getting caught in the net that we're casting just because we are biased towards that criminal justice data, which really just reinforces the need for us to have information from other sources. Next slide. So this is where we've begun working towards our long-term solution. So in Fulton County, we use the Odyssey Criminal Justice Data Management System, which is operated by Tyler Technologies. So Fulton County already has an existing contract with Tyler Technologies for the operation of the Odyssey system. And what we were able to do was we leveraged that existing contract and added a little bit more funding to have Tyler Technologies also begin building out a integrated data tool. So this data tool, initially we're targeting a few high value systems, like our the primary agencies that we really engage with. So those are, well, one, obviously Fulton County and the Odyssey system, Grady Health Systems, which is, like I said before, our largest safety net hospital, Atlanta PAD, which is our pre-arrest diversion program. And then we are also targeting a statewide HMIS integration in Georgia. And so the general idea is that, well, I'll back up. In November, we began convening bi-weekly meetings with all of those partners, as well as our county attorney's office, to begin hammering out a memorandum of understanding, which would allow for this data sharing generally, and then also a universal release of information form, which would be present at intake at all participating agencies and would allow individuals to consent to have their information shared through this integrated data tool. So we have been engaging in these conversations for about 8 months now. And we are finally in a place where we are finalizing our MOU. We have finalized the release of information. And once we have dotted our I's, crossed all our T's on our MOU, our county board of commissioners is going to vote on and hopefully and probably approve this MOU, in which case we'll go into the implementation phase of this data sharing tool. Now, I want to be clear about like what this data sharing tool is. It's very basic. We're not sharing PHI. We're not setting this up to share like diagnosis information. What we're calling it is our behavioral health phone book. So if let's say I turn up at Grady Hospital, I'm having a behavioral health crisis, a mental health crisis, but I have at some point agreed to allow my information to be shared. A caseworker at intake at Grady would be able to look up my record. They could see that, oh, I've engaged with such and such homeless service for the past couple of months. Let me reconnect this individual, or reconnect me back into this housing service or whatever service it might be, so that a crisis or health event is not going to prevent me from, it's not going to make me fall out of that service. I'm going to still be able to remain engaged, continue getting the care that I need. And the general idea is that we want to build this very basic system to start, and then have our legal agreements structured in a way that more agencies can sign on to share their data as we progress through the work, and as we kind of prove the effectiveness of this kind of information sharing. And then we also want to eventually scale this, basic tool up to something much more advanced, that could possibly serve as a more comprehensive case management tool that isn't just native to one of our participating agencies, and that would actually serve, or would serve as a repository of information as well as case management across Fulton County and City of Atlanta agencies that already are working together as a matter of necessity. This would just allow for the more formal data sharing relationship to exist. And one of the big reasons that we want to do this is that we are opening a diversion center in Fulton County, ideally summer of 2023. And we see this kind of data sharing case management tool as being a very good fit for the diversion center, as it will be already coordinating with these participating agencies anyways. I mean, generally that is the concept. That is what we've been working on. Our technology provider has built demos and mock-ups. We've begun having feedback sessions with end users. Our legal agreements cover, required data fields to share. And we're drafting a policies and procedures, a standard operating procedure document to cover the operation of this system. And I mean, it's been going very well for us compared to the stagnancy of this project in years past. I am ready to answer questions or move on to the next section if we are.
Why don't we go to the next slide? And it's questions and answers. This is Risa jumping back in here. And Nick, maybe how you guys have worked around this in Fulton, and then Bob, if you want to, also advise. The only question I saw in the chat box had to do with, if data integration systems are a way of being able to quote handle protected health information. And before I jump in, I'd just like to maybe hear Nick, you already mentioned that what you're planning on sharing is not protected. Just a couple disclaimers before we go into this is that it's really important that you first and foremost look at your state level regulations on protected health information. Many times we see states are a higher bar, if you will, than the federal HIPAA guidelines. So just be careful of that. And then, so first of all, if we want to tackle HIPAA, and now I see another one about the data points that you are going to exchange. So Nick, you want to take it?
Yes, sure. So in terms of data points to be exchanged, there's the basic required data elements. So names, date of birth, gender, race, and social security number. Which will generally be used to create a match across data systems. Outside of those required elements, the elements are just very basic. It would be, does this person have a record of involvement with your agency? So it would say Grady Hospital, or it would say Fulton County, or it would say HMIS. It would also include like that person's case manager, if they have one, and contact information for that case manager or the organization as a whole. So it would just be a way of reconnecting people to organizations that they are already connected with in some way. I'm sorry, what were the other questions?
So Nick, I wanted to just circle back because I was a little surprised that you considered social security number as required.
Yeah, well, it's required when it's applicable. So not every agency collects it or has it populated within their system. But if it is in your system, it is required to share. Because this will obviously up the quality of the matching a whole ton. And in cases where social security number is not available, there will be instances in which multiple records for an individual have to be created because we can't ensure that an individual is the same across data systems.
You want to jump in? Anything to add on protected health information in particular?
Was that directed at me, Risa?
Yes.
Yeah, okay. Yeah, and getting back to that first question, the jurisdiction is going to be ultimately responsible for complying with HIPAA. Your vendor can likely be a great help with you and especially in the technology used to try to protect it, such as user access, user roles, and so forth. But you're going to have to develop the policies and procedures to comply with HIPAA that they will build to make sure that functionality works. But if they, for example, if the vendor has not done work in your state or county, they may not even be familiar with some of the state rules, statutes that you have to comply with in addition to federal. So you just need to go into that with your eyes open. I don't think there's a perfect answer for that, but it's going to ultimately fall upon the county. So to make sure they're complying with HIPAA and design the user roles to make sure that, for instance, people who are not authorized to see the mental health case information cannot access that in the data warehouse, but they can access other information like Nick's referring to that is in the warehouse. So that is still helpful to them. So I hope that answers your question. That's the way I see it.
Yeah, and I just want to share some of my past experience coming from a county that has a pretty sophisticated integrated data management system. Is, first and foremost, I feel like people want to hear an easy way out on this, but the bottom line is if you're going to share personal health information, be it from a probation officer to a mental health professional, you're going to have a release of information. You just can't skip that step. So that's why many of these are really more set up as a way of just doing a basic match. It doesn't involve sharing the health information, and that's your clue to get the release of information that you've got a match there in terms of your agency and another agency or a couple other agencies are all working with this same individual. And then from there, you acquire your needed releases so that you can hopefully then work as a team and collaboratively with the case management for the individual and certainly hopefully work together for improved outcomes and sharing of resources and those kinds of things.
And the more experienced the vendor is that you select, they can bring some ideas to the table to help you meet those requirements that they've perhaps done in the past. So, but again, ultimately, you cannot let them make those decisions. You have to make those decisions, but they can bring some more information to the table to maybe some creative ideas to help do what Risa and Nick's been talking about.
I'd love to hear, I know you can either put your questions in the chat. Again, I know that this is just one of, a very difficult process for counties to pull all this together. Other questions or other examples or case scenarios that you have, we would, just love to, use our time here with both Bob and Nick. If there's anything else we can address for you today.
Yeah, we do have a couple other questions, Risa. So I'm not sure if this one was there. So does the sheriff's office enter data from the jail screen into the database? No.
Yeah, so no, they do not. Our screening is conducted and entered into our Department of Behavioral Health's database by the jail medical provider. So the sheriff's office does not enter that information.
I don't think it's to say that they couldn't. It's just that the way it's set up in Fulton County, they aren't.
That's correct. I mean, the sheriff's office does enter the vast majority of the data that we get from the jail, but not that piece. And that is what we have linked up through our own, or from the Department of Behavioral Health's own database to create dashboards and have that information available to us.
So Nick, is it safe to say in your situation that if you would kind of say there's a home database, for you, it's the behavioral health one. And from there, you reached out and started adding in and building from other databases. But I will say that I think I see most of the time, the home database, if you will, is from the jail. And it's a good place to start from, because generally, if a person's been booked into a jail, even charges, et cetera, is public information. Now, I've worked in like Pennsylvania and places where that's not the case, but generally you'll see that is public information. So then it's a matter of, building from there, going to whether it's your HMIS or hospital emergency, like in Fulton, it's Grady, and working through then how you're going to, get your memorandums of understanding in place for information that's more confidential.
Hey, Nick, is the data entered real time, or is it like a daily or weekly dump, or how do you do that?
It is entered real time, but it's updated daily.
Okay.
So it's updated every day at like 5 a.m.
Okay, so one of the questions is the jail screen PHI. And it's not, of course, a flat answer. Never is. But generally speaking, if you're familiar with HIPAA rules and so forth, jails are, I guess I'll use the word exempt, for information shared inside a jail, right? And then when we work with sites, particularly with stepping up and implementing a validated screening tool and having that process in place and then entering the results of that screen into, it generally, I will say, works best if it's entered into the jail management system. I know many times it's housed over separately in the jail medical provider system. So in most situations, if the jail is not a covered entity, which is all HIPAA language here, then that screen is not protected health information because it is not a diagnosis, it's a screen. And because generally speaking, a medical professional has not completed the screen. So in many ways, you're even more protected if jail staff, the booking officer, whoever, civilian, does that screen, because in order for information to be protected health information, it needs to be done by a medical professional. It needs to be a diagnosis involved and so forth. Now, Bob and Nick, jump on here if you've seen that not be the case, or, if it's not kind of the rule of thumb. Again, you would need to go find out about your jail status and state and local, any kinds of guidelines you have.
With my experience, it's what you describe is accurate.
Yes, that is that we agree.
I will say that I would venture to say that in your county, you have a security officer that has to be designated. In any county that, and name me a county that is not in some way sharing protected health information, just because of the fact if you run a county health department or mental health agency or what have you, and you do billing, you're right there most likely sharing protected health information. And therefore, to be under HIPAA compliance, you have to designate a security officer who should be somebody that is very trained up on your HIPAA policies and processes for you and your state and so forth, in order to make sure that that whole process is done under compliance. And therefore that would be my go-to person in your home county to work with as you establish any sorts of integrated data sharing process that you want to put in place. Any more questions in the chat, Ethan?
There was one, I'm not sure if this one was answered yet. So, I know Nick was sharing about Fulton County, but this was a question about being a statewide program versus a county. And so I'm not sure if Nick or maybe Bob has an example of this being rolled out as a statewide program.
I don't have an example, but I can tell you a little bit about us. So like this, our project is very much focused on Fulton County, but I mentioned that we were targeting a statewide HMIS integration. And that's on the advice of some individuals from the HMIS steering committee. And basically their reasoning was that this kind of information sharing is very much like it's happening everywhere. And they are kind of preparing for it anyways. So it would make sense for us to just go ahead and target a statewide HMIS integration rather than try to do it piecemeal between every continuum of care that covers Fulton County, Atlanta, and the broader metro area. That if DCA is going to allow this kind of data sharing anyways, if they're going to allow it, then we should try to do it statewide regardless. And then that kind of perfectly fits with our concept of wanting to scale this work up anyways. So if we can go big early, we're more than happy to do that.
And I'll add on to that. I just worked with a state a few years ago on a justice mental health collaboration project grant from the BJA to build a statewide behavioral health justice database. And so what we did is we took a team of experts in and designed the technology roadmap to get that done. I will say that the state was very advanced in all the things we described about the checklist and the brief, getting all the right groups, and they were working on this for years before we got involved. So they had everything in place. The only thing that was missing was the funding, and unfortunately that was sort of aligned, but the state redesigned their IT system and basically centralized everything under the governor's office, and the people that we were working with at the agencies, the Colorado Department of Public Safety, were moved over, and a lot of things happened at the time. So, but they had a lot of the pieces in place, and to be honest with you, I think it's very feasible at the state level as well as the local, especially where they have a lot of the pieces already in place. I mean, they had working groups, they worked together to get legislation passed on statewide prescription practices and so forth. So they were doing a lot of things very effectively at the state level already. So doing this was not technologically impossible. It was just a matter of funding, really.
Thanks, Bob. I don't know if you want to tackle the next one. And also Nick as well. Just, we mainly have been concentrating on really screening for serious mental illness. But when we get into substance use disorders, we know that 42 CFR Part 2 is even more restrictive. So I don't know exactly how you want to advise, if any, differently in terms of probably, just best to get the release of information.
Yeah, I don't have a great answer for that. I mean, it's not something that we have really engaged with thus far. But I do think it will be something that we are going to have to address once we really start to scale this up. We know that substance use is a big issue amongst a lot of the individuals that we're trying to serve. And it's frankly growing in Fulton County. But it's not something that we have a good handle on. Grady does not, our safety net hospital does not do a ton of substance use treatment other than treating people for like an overdose. And so it's not, none of the agencies that we're initially engaging with are expressly devoted to substance use treatment. But once we begin trying to integrate that information into this work, that will obviously be something that we need to take a long, hard look at and really get through with our county attorney's office.
Yeah, and if I could add on, it's something to be highly aware of, because if you're importing data, for instance, from jails where they do jail screening, it's likely to show up on a screening result and could end up in your database, even if that's not your focus. And that, as Risa said, the restrictions on that data is much more much more strict than HIPAA, and all kinds of other things kick in. Even if you do waivers, you know, the waivers for 42 have to be specific to the who, for the purpose, for how long, and so forth. And those expire, and you need to go back and redo them. So you got to make sure your system purges that information at the expiration, so it's not accidentally still available after the waiver has been signed and expired. So beware of it and be careful of it. If you're in a system like Fulton where you're not really looking at that, but that data could creep into your system if you don't look for it and make sure it doesn't happen, and is screened out or blocked or somehow until you get to the point where you're going to deal with it appropriately. But like Nick said, what is it, 60-some%? I can't remember now, the dually diagnosed people who are likely to have these issues as well. So it's two problems that really can't be separated.
Great point.
Right. I'm going to say thank you. I want to personally thank Bob and Nick today, because I've worked so closely with them in helping to develop this guidance. And I also want to turn it back to Ethan to close us out today.
Yeah, I just want to say again, a huge thank you to our panelists and certainly to all of our participants and your participation. You know, we really appreciate you all showing up today, and that this is helpful for you. I do want to point out something I saw in the chat and certainly encourage others to do this. You know, as we have these webinars, please network with each other. Thumbs up to Arkansas for reaching out to each other and trying to network. I think that's excellent. So with that, we can end, and everyone have a wonderful day.
Thank you all.
Thank you.
Take care.
Thanks, everyone.